The roaring economy is roaring like never before, and our enemies are scared, our military and police are stacked, and America is respected again, perhaps like never before.
Welcome back to CBS Mornings. President Trump painting a very positive picture there during last night's State of the Union address. But is the economy really roaring? And what about another important issue for Americans, health care? Joining us now, our CBS News medical contributor and editor-at-large for public health at KFF, Dr. Celine Gounder, and CBS News business analyst Jill Schlesinger. Great to have both of you. Glad we're going to dig into the issues. So, Jill, you heard the president says the economy is soaring. But if you look at our CBS News poll, more than half Americans think the economy is bad. What's the disconnect?
Well, the disconnect is that the economy grew at a slower pace last year in 2025 than it did in 2024. And for us, consumers, our lived experience on the ground is not about economic numbers. It's about how much things cost. Yeah. The inflationary surge after COVID has pushed prices up. The rate of the increase has come down. That's the inflation rate. Prices are still high, so people are really still struggling, and that is why what explains the consumer confidence down, and of course, why people are telling us in these polls they're not feeling great about the economy.
I understand that when we talk economy, it's different for everybody, right? It's really dependent on what you're going through in the moment. But let's just talk about people that might have a stock portfolio, and they're looking at the stock market saying, whoa, things are good right now. And President Trump, he's talking during the State of the Union and says, look at what's happening in the market. It's all because of me. So is there a disconnect there, or do we need to give credit where credit is due?
We have always had this problem where the stock market is not the economy is not the stock market, okay? If you own a stock, you're among the 60% of Americans that owned a stock, a mutual fund. Sure, the market was up by more than 16% last year. Great. But that really means that your retirement account might have gone up a little bit. A lot of people can't access that money. Again, lived experience on the ground. Prices, affordability, health care, child care, elder care, cost of education, cost of rent. All of these things, even the price in the grocery store, these are still the problems that people are confronting.
Yeah. Celine, let's talk about health care. He didn't spend a lot of time on health care last night. Was there something you were hoping to hear from him?
Well, quite frankly, I was surprised there was not more of an acknowledgement of pain, the pain that people are feeling. Health care is the #1 financial concern for Americans now, ahead of rent, ahead of food, utilities, gas. It's health care. And over half of Americans say health care costs have increased for them over the past year. So for that not to have been addressed, for that acknowledgement of we feel your pain. The other thing that he did not address is that the biggest driver of increased health care costs are actually hospital care and physicians, doctors like me, by the way. And he didn't really talk about what was being done or what might be done to curb those costs.
He did talk about the Trump RX plan. What's your take on that?
Well, that is essentially a website where you can download coupons. Those are coupons for a discount on your drugs.
I went on it the other day.
You went on it?
Yeah. I did. I looked for a coupon and it wasn't there.
Well,
but Good RX did have it.
Yeah, it's only for very specific drugs, and it's only going to help you if you're essentially a cash pay patient, if you're somebody who has Medicare and you have some very expensive brand name drugs. If you're somebody who has commercial insurance, you're probably better off just using your insurance, not paying cash.
Because are most people cash pay
Most people are not. Most people are not. And if, let's say, you don't have any insurance.
No, you can use Good RX if you have insurance.
Good RX, yes, but not the Trump RX discounts. Those are for cash. And then, if you're somebody who doesn't have insurance at all, do you think you can really pay cash for your medications? It's not really going to help those folks.
Yeah, I hear you on that. Jill, he also mentioned these Trump accounts. What can you tell us about that? I was trying to unpack it and then research while I was watching this.
So these are education savings accounts and retirement savings accounts. It's sort of like, think of it like a Roth IRA for your kid. $1,000 goes in for every child born starting last year for the next 3 years.
You have to apply for it, but it sounds like a good thing.
It is a great thing.
It's a great thing.
It really is a great thing. Yeah. You can do it during tax season, by the way, but it opens up in July. And parents and employers can add to those accounts. Just if everybody has a kid in the last year or going forward the next 3 years, it's a really good thing to have. It has some special tax treatment. If you're really trying to save for education yourself, though, those Section 529 plans, they are the best way to save for education.
I have 3 kids going to college. I love them. Yes.
Look at that. And you're done with college, Gayle. How happy are you?
Trump also claimed that tariffs could replace income tax.
No. Absolutely not. There's no way. We're talking about the government taking in a couple $1 trillion in federal tax revenue. Last year, the administration brought in $300 billion of tariff revenue. And by the way, about 150 of that is going away because of the Supreme Court decision. So there is no chance that tariffs can replace income taxes. Sorry, gang, go pay your taxes.
All right. Well, thank you so much. I appreciate it. I see a new show coming up, Wealth and Health.
Yes, that's good.
Jill and Doc.
Oh,
we appreciate
yeah.
you, Jill Schlesinger, Dr. Gounder.